Goals of learning. By the end of this presentation, you should know what are the cardiac risk factors, or what are the factors that predispose you to get that heart attack. You should know what is the difference between factors that can be modified and that cannot be modified. I use the term factors that can be controlled and cannot be controlled, because once you know that these are the factors that can be controlled completely, you will try to control them, not just modify them, but control them to bring them in the normal range. You should not only know what are the risk factors that can be controlled or modified, you should know how to do that so that the heart attack that you may get otherwise can be prevented. Risk factors for a heart attack and how to prevent a heart attack from occurring. I am Dr. Anup from Anup Research and Multimedia. See, about 20 years ago, we did not have a good idea about what are the risk factors for a heart attack. We knew a little. We knew that probably high blood pressure in some ways associated with a heart attack, but we did not have a good idea. Compared to that, today we know what causes a heart attack, what are the conditions that predispose a person to have a heart attack, and the best thing is that we know how to control those conditions that are responsible or that increases chances of a person getting a heart attack. For the first time in history of mankind, we have the ability to control most of the factors that can cause and can predispose a person to have a heart attack. Let's see what are those factors and how can we prevent a heart attack from occurring. Many issues that are described here are described in details in many other DVDs that we have. If you are interested in knowing the details about any of the issues that is being discussed here, please go and refer to those DVDs and videos and learn from them. See, the factors that increase a person's chance of getting a heart attack are divided into two. One is the factors that cannot be modified, and the second is the factors that can be modified. Let's first look at the factors that cannot be modified. These factors include your age. You see, heart attack is more common in men who are above the age of 45 years and in women who are above the age of 55 years. Now, you cannot change your age, so this is a factor that cannot be modified. Another similar factor is the sex. Heart attack is commoner in men than in women. So being a man and being above 55 years of age is two cardiac risk factors. We will talk about number of cardiac risk factors and why it is important to know as to how many risk factors you have, because that will decide what treatment you get, what treatment you should be receiving to prevent the heart attack. Another factor that cannot be modified is the race. If you are an Afro-American, or if you are an Asian, or if you are a Native American, you have higher chances of getting a heart attack. But you cannot change your race, so that is a factor that cannot be changed. The next factor that cannot be changed is a past history of a heart attack. So if you had a heart attack, there are 25% chances that you will get another heart attack. So 1 in 4 people who had a heart attack in the past get the second heart attack. So having a heart attack in the past predisposes you to get the second one. The next is the ischemic heart disease. If for any reason your heart is not getting enough blood, and even if you did not have a heart attack yet, you are more likely to get a heart attack if you have ischemic heart disease. That means like conditions like angina. In angina, there are many types, there are many symptoms. We cannot include all the symptoms here. There is a separate presentation on ischemic heart disease and angina, but suffice it to say, if you get chest pain on exertion, or if you get short of breath when you are angry or excited or doing a little exercise, so there are many symptoms of angina. The space does not permit me to talk about angina and ischemic heart disease in this presentation, but feel free to go to our full presentation to see what the signs, symptoms, causes and treatments are for angina and ischemic heart disease. Suffice it to say that if you have ischemic heart disease, you are more likely to get a heart attack compared to a person who does not have ischemic heart disease or angina. Those were a few factors that cannot be controlled by you. Much more important are the factors that can be controlled, because you can modify them, you can control them, and by doing so you can minimize chances of you getting a heart attack. The first factor that is controllable and that increases chances of getting a heart attack is diabetes. If you have diabetes and if it is not well controlled, then it predisposes you to get a heart attack. We have a full series on diabetes, which is 10 DVDs. Feel free to have a look at that. What is diabetes? Diabetes is a condition when your sugars are high, and these high sugars, in some yet not very clear way, we don't know why they cause, but these high sugars cause damage to the vessels, and vessels are the one that carry the blood to your heart, and damage to these vessels increases your chances of getting a heart attack. However, if the diabetes is well controlled and the blood sugars remain in normal range, then your chances of getting a heart attack because you had diabetes are decreased. Diabetes works with many other conditions, all of them working together to cause a heart attack, and we will talk about those conditions also. The next condition that predisposes you to get a heart attack is high blood pressure. You see, to flow, blood needs some blood pressure. Otherwise, the blood will not flow in our body. Just like the water need to flow in pipeline needs some pressure. Otherwise, the water will not flow. Same way, the blood needs some pressure to flow, and that pressure that is present in our vessels is called blood pressure. The normal blood pressure is below 120/80. There are two types of pressures that are measured. One is called the systolic pressure, that is the upper pressure, and the other is called the diastolic pressure. The systolic pressure occurs when the heart pumps the blood in the vessels and then the pressure rises. This is called the systolic pressure. When the doctor talks of your pressure being 120/80, the 120 is the systolic pressure. The systolic pressure goes up in people who are older, people who have high blood pressure, diabetes, who smoke, etc. So systolic pressure can go high in conditions where the vessel becomes stiff, and that's why cannot easily act like an elastic. Normal blood vessels can expand like an elastic. When the pressure rises, they expand and the pressure comes down. But if the vessels are stiff, they cannot expand, and that leads to a higher pressure. So systolic pressure is common, very common. More the age, the higher the chances of getting systolic blood pressure. If only systolic pressure is raised, it is called isolated systolic hypertension, or ISH. The other pressure, which is the lower pressure, is called diastolic pressure. That is the pressure which is present in your vasculature, in your vessels on a continuous basis. Even when the heart is not beating, the blood is flowing in your body. heart beats like once, then it relaxes. So even when it is relaxing, the blood is flowing, and to maintain that blood flow, some pressure is required, and that is called diastolic blood pressure. Normal diastolic blood pressure is below 80, and if it is higher than that, then it is called hypertension. If your systolic pressure is between 121 and 139, it is called prehypertension, and if it is 140 and more, it is called hypertension. Similarly, if your diastolic pressure is between 81 and 90, it is called prehypertension, and above 90, it is called hypertension. In my opinion, it doesn't matter if it is prehypertension or hypertension, because even prehypertension increases your chances of getting a stroke. Your chances of stroke are slightly more even when you have prehypertension. So from all practical points of view, prehypertension and hypertension are equally dangerous. You don't take it lightly if you are told, okay, you only have prehypertension. If you have blood pressure, ideally your doctor will try to decrease your pressure to below 120 over 80, but there is an important condition that you should remember. When the doctor is decreasing the blood pressure, you should not be developing any symptoms because of low blood pressure. Symptoms because of low blood pressure are like dizziness, blackout in front of eyes, because enough blood is not reaching the brain. So if you do not develop any symptoms when the blood pressure is being lowered because it was high before, then your pressure can be safely decreased to below 120 or 120 over 80. However, if you are feeling symptoms, then probably the doctor will need to make a compromise and leave your pressure at say 130 over 90 or something like that. But the best blood pressure is below 120 over 80. But remember, there should be no symptoms of low blood pressure when your pressure is being lowered. If you have any symptoms, talk to your doctor. Coming back to the heart attack, lowering of the blood pressure improves your chances, and if the pressure is within the normal range, that is below 120 over 80, your chances of getting a heart attack because of high blood pressure are significantly decreased. On the contrary, if your blood pressure is high, say 180 over 100, 190 over 110, something like that, your chances of getting a heart attack are much higher. See, 1 in 3 people have high blood pressure. It's a very common condition. 1 in 2 people who have hypertension, their blood pressure is not under good control. So you can imagine there are very high chances that your blood pressure will still be high even when you are taking some treatment. So make sure you know the numbers. In the past, it was good enough to know just the diagnosis that okay, I have high blood pressure, I have diabetes. But now, in today's date, it is very important to know the numbers, because a good control of numbers is much better than just knowing that you have a certain condition. So high blood pressure, control it well to minimize chances of a heart attack because of high blood pressure.